Okay, so for the extension portion of the assessment, your arms are going to be above your head, and what you're looking for is, can you extend your neck? Can you extend your mid-back, your low back? Keeping your legs straight, can you push your pelvis forward and extend back through the low back? So it looks like this. So arms are going to go above your head. You're going to okay, arms up and then extend back. All right, so now we're going to talk about some exercises you can do with your findings in regards to the assessment. So the first one we're going to talk about is the assessment with extension. So if you're locking in the mid-back, when you extend it back, you couldn't actually extend your back backwards, then the following is some exercises you can do, as well as if you can't get your hands over your head. So if you can't get your hands over your head, what you can do is you can take the foam roller, you put it just below the rib cage, so at the 12th rib, and you're gonna lay on it. You're gonna have your arm above your head, and you're gonna fold over onto the roller. Now, the distance between the floor and your shoulder should be very close. There shouldn't actually be a space between the two. So if I'm up here, that's going to restrict our shoulder range of motion. And you're going to fold over, and then you're going to move the foam roller up, fold over, move the foam roller up, fold over. So that's if you can't get your hands over your head. Now, if you can't extend your back, then what you're going to do is you're going to get the foam roller. You're going to put it just below a woman's bra strap. You're going to put your hands behind your head and support your neck. You're going to have your elbows opened up. And then what you're going to do is you're going to extend backwards from the mid-back. So you're going to take your chest up to the ceiling. And fall back. So making sure your knees are bent and your bum's on the floor. Then you're going to roll, so your vertebrae are really, really close together. So then you're going to lift up, you're going to roll the roller towards your head, and then you're going to go to the next vertebrae. And then come up, lift up. And there's going to come a point where you can't go any further. Now, your upper spine also rotates. So, in order to increase extension in the mid-back, you take the foam roller, you lie over it, you keep your hip over the foam roller and the knee on the floor. You're going to have your arms straight out, and then what you're going to do is you're going to rotate your arm over to the other side. Now, my arm should be actually on the mat, on the floor. Now, if I roll my hip, you can see, oh look, I actually can get my shoulder there, so that's cheating. So you need to keep that hip stable, and it's just a movement, so you're going to do 10 of those. And then you flip to the other side. Now you may find one side is better than the other. See, this side is worse. Now, if it's your mid-back that you can't extend, then you're gonna get in on all fours. You're gonna drop your shoulders down, and then you should be able to move your shoulders and your hips away from the ground, and then you should be able to squeeze everything together, rotate away, squeeze. Now, if the problem is in the lower back, you lack extension in your low back, so back here, then what you can do is a couple things. You can go and you can do a cobra. So hands at your nipple line, and you can keep your hips on the ground and lift up. You can do 10 of those, making sure your hips stay on the ground, or you can go up onto all fours and you can actually drop your hips to the ground this way. And then last but not least, if when you extend, you bend your knees, then you can stretch your hamstrings out. So I like to use a door frame. You make sure the leg is straight, your bum is close to the wall, so as close as your hamstring will allow you. The other leg is straight out, and what you're going to do is you're going to push your knee into the wall. Now you can feel that in your low back, or you may feel that in your hamstring. You can do that 3 times, hold 10 seconds. So do it 3 times. Pushing your foot into the wall. And after you've done that 3 times and you hold 10 seconds, you're going to move closer to the wall, making sure your pelvis is flat on the floor, your leg is straight, and you should be able to move closer to the wall.